Every county in California is assigned to a tier based on its test positivity and adjusted case rate. Counties must address COVID-19 in all communities to open further, including making sure the positivity rate in certain neighborhoods, health equity metrics, does not significantly lag behind overall county positivity rates. New stay-at-home requirements for counties in the purple tier. COVID-19 in Los Angeles. All the information you need to stay safe, stay healthy, stay home. Restaurants and bars. Restaurants, breweries, and wineries may offer only food and beverage via takeout, drive-through, or delivery. Wineries and breweries may continue retail sales operations. Fitness centers. Gyms and fitness centers must cease operations between the hours of 10 p.m. and 5 a.m. Capacity for outdoor operations is currently limited to 50% of maximum capacity. Close contact services. Close contact services are not currently allowed to operate per LA County Department of Public Health. Close contact services include, but not limited to, esthetician, skincare, and cosmetology services, non-medical electrology, body art professionals, tattoo parlors, microblading and permanent makeup, piercing shops, massage therapy, non-healthcare, tanning services. Barbershops and hair salons. Barbershops and hair salons are not currently allowed to operate per LA County Department of Public Health. Retail. In-person retail establishments are permitted to operate under restrictions. Indoor malls and other non-essential retailers are allowed to operate up to 20% of their occupancy. Essential retailers are allowed to operate up to 35% of their occupancy. All non-essential retail businesses must be closed for in-person retail operations between the hours of 10 p.m. to 5 a.m. House of worship. House of worship may provide services outdoor. Indoor services are currently not allowed. Offices. Offices for essential sectors may open up to 25% of their maximum occupancy. Office-based work sites for non-essential sectors may only open for minimum basic operation. Indoor cultural spaces. Indoor cultural spaces are not permitted to open, including museums and indoor historical sites, country clubs, gambling establishments, amusement, bowling alleys, arcades, movie theaters, and theme parks. COVID-19 has impacted some communities more than others. They face higher rates of infection and death. These include our Latino, Black, Pacific Islander, low-income, and essential worker communities. A California Healthline review of local data from the state's 12 most populous counties found that communities with relatively high poverty rates are experiencing confirmed COVID-19 infection rates 2 to 3 times as high as rates in wealthier areas. Epidemiologists say the findings offer evidence of the outsized risk being shouldered by the millions of low-wage workers who live in those communities and do the jobs state and federal officers have deemed essential in the pandemic. These are the grocery store clerks, gas station cashiers, home health aides, warehouse packers, meat processors, hospital janitors, and myriad of other retail and services employees whose jobs keep the rest of us comfortable, clothed, and fed. These jobs cannot be done remotely. 5 ways to stay safe. Cover your face in public. Practice good hygiene. Monitor your health. Keep your distance. Stay informed. Testing.
There are 2 main categories of tests in the fight against COVID-19: diagnostic tests and antibody tests. Diagnostic tests can tell you if you currently have an infection. The FDA has authorized many diagnostic tests for COVID-19, including molecular tests. Molecular tests work by looking for the virus's genetic material in a sample from you. The sample is then usually analyzed in a lab. For some tests, the sample can be analyzed at the point of care, such as at a doctor's office. FDA-authorized molecular tests are very accurate, and results are returned anywhere from minutes to several days, depending on the test. Antigen tests are another type of diagnostic test that see if there are viral proteins in a sample taken from inside your nose with a swab. These tests are often simpler and may provide results quicker than many molecular tests, sometimes within minutes in a doctor's office. Although antigen tests can be less accurate and may need confirmation with an additional diagnostic test, they can be made more widely available because they're easy and simple. The other category of test is an antibody test, sometimes called a serology test. Antibodies are produced by your body when you're infected by a virus, and they help your immune system fight off the infection. An antibody test detects antibodies to the virus using a blood sample. If an antibody test finds antibodies in the blood, it likely means the person has been previously infected with the virus. Antibody tests do not show if you have a current infection, and they should not be used to diagnose a current infection from COVID-19. The results from antibody tests can help us better understand questions about exposure to COVID-19 by helping identify who has been infected and has developed antibodies, if antibodies may provide protection from future infection, who may still be at risk, or who may be eligible to donate a part of their blood called convalescent plasma, which may serve as a possible treatment for those who are seriously ill from COVID-19. If you have questions about COVID-19 diagnostic or antibody tests, talk to your doctor. Testing is crucial to guiding our next steps in the fight against COVID-19.
How to get a test. Call your healthcare provider. If you need help finding a healthcare provider, call 211 or visit 211la.org. People who live in LA County, regardless of immigration status, can apply for an appointment for a drive-through or walk-up test by visiting lacounty.gov testing or by calling 211. You can also get a test at some pharmacies. Check your local pharmacy. Testing through the County of Los Angeles and the City of Los Angeles mobile testing sites is free for all LA County residents who meet the criteria for testing, regardless of their immigration status. Visit covid19.lacity.gov/testing/.